Good afternoon, everyone. Rob here from Nutridyne Europe, and I'm excited to welcome back Dr. Robert Silverman for part 2 of his health and immunity webinar. The webinar will go on for roughly around 60 minutes, during which you can ask questions using the tab on the right-hand side, and I'll come back at the end of the webinar to ask Dr. Silverman your questions. So I'll now pass you over to Dr. Rob, who will now begin. Cheers.
Thanks so much, Rob. It's a pleasure to be here. I'm excited to share all the information in part 2. This information is going to be vastly different than we saw in part 1. We're going to take a few steps. We're going to show you some different products, some different protocols. And for the questions, ask any questions on the material, but I would love to cover in the question section what to do for your patients now and what to do when things go back to normal or pseudo-normal, because again, every country is in a different state with this immune function, but I can tell you without question, the emails I'm getting from practitioners across the world and my patients, everybody's asking about immunity, since there's no alternative answer to the natural approaches that we offer at this point. So I think this is a great moment for us in that we are the type of practitioner, a functional medicine, functional nutrition practitioner that offers people and patients some answers to help with their immune system. Having said that, let's talk about health and immunity, a natural perspective for a new paradigm. And this is part 2. Importantly, COVID-19 cannot gain entry to our homes or our bodies by itself. We have to let it in. That's very true. We're very concerned about the contagion. We still have to let it in. It's typically passed through the oral pharynx. So clearly, if you were to wear a mask, clearly if we were to keep our hands clean, clearly if we had a proverbial physical and social distance, it would truly decrease the incidence. One of my friends works in a huge medical center, and none of their doctors have gotten sick, even though, remember, I do live in New York and I live in the hotbed right by the epicenter. These practitioners didn't get sick, even though those patients in front of them, because they wore the necessary equipment to protect themselves. A virus is not live. It's either active or inactive. The best defense is a strong offense. And some of the best offense that we can do is just avoid the contact to our eyes and mouth and keep our immune system in a uniquely pristine condition. So here are some underlying conditions among hospitalizations with COVID-19. So it's very interesting in that here we've got hypertension for those, the #1 comorbidity for those over 65. Between the ages of 18 and 64, it's obesity. Now, of course, obesity is a major issue. 43% of Americans are obese, 75% of Americans are overweight or obese. The UK and Britain are not that far behind. So this would definitely parallel what would be going on where you live right now. Interesting, when you look at many of these conditions, obesity, hypertension, diabetes, cardiovascular disease, these are lifestyle comorbidities. So without question, right now, to me, I'm looking at this slide and I'm looking at what I want to do if I go back to work or when patients call me, other than build their immune system clearly, I want to help them with their lifestyle. The comorbidities are lifestyle. And when we get to immune system, I want to be very specific on the approaches and the theories that will work to enable us to get those outcomes with the patients. So 90% of COVID-19 admissions involve those comorbidities. That's shocking. So again, our major comorbidities are the ones that we mentioned, and you could add autoimmunity. There were just 6 more that were added yesterday. And in those 6, the reason they were added, it was fever, it was chills, it was fever with chills and such, was because in America, if you wanted to get a test, you had to show one of these symptoms. So here you saw that with one or more underlying conditions, it was 94% of people who were admitted to the hospital over 65, and you can look at these numbers and they're quite striking. So hypertension was the most common comorbidity. There are different charts that you'll see, but hypertension always comes up. CVD, and obesity. Once again, this is a synopsis of what we showed you in the previous graph, that older groups had hypertension as the number one comorbidity, and younger groups had it as obesity. Many groups had more than one comorbidity. So here's the rates of hospitalization for COVID increase with age. So the takeaway is the older you were, the more apt you were to be hospitalized. A couple of reasons for that. Number one, typically if you're older, your immune system isn't functioning as well. It's part of your degeneration process, if you will. In addition to that, you're also going to notice you have more incidence of comorbidities as you age. So the takeaway here is, and everybody should know this now, everyone, especially older adults, should stay at home and quarantine, as you guys are, use face coverings when in a public setting, and always wash your hands frequently for some very, very basic things. What's a little disconcerting is on average, only 6% of the SARS-CoV-2 infections were detected worldwide. So to have herd immunity, if you will, which we've heard a lot about, each number in each person speaking about it has given a different number. Bottom line is herd immunity is anywhere from 30 to 70%. So that's clearly a wide range of numbers. And the actual number of infections may have already reached several tens of millions. We're just really not sure because we just don't have enough testing worldwide. This was striking to me. So here they had test results from 215 women in a New York City hospital, which again is the epicenter, presenting for delivery. Slightly over 15% were positive for SARS-CoV-2. Of those slightly over 15%, 13.5 were positive, but they were asymptomatic. Little less than 2% were symptomatic and positive for SARS. Now, to me, 15% is quite high for a pregnant woman because they're watching as much as they can. We know in comparison in New York City, it's about 20 to 21% of people have tested positive for COVID-19. So ABO blood group, it's interesting in that in COVID-19, this was over 2,000 positive patients. Blood group A had a higher risk factor of acquiring COVID-19. Blood group O had a lower. So they don't know why. They just know that those numbers were recorded, and it was a substantial difference between the two. So here we have long-term exposure to air pollution. So again, these are lifestyle components that long-term exposure to air pollution increased the mortality in the US. So here's the first link between long-term exposure to pollution and COVID-19 death rates. Persons living for decades in a country with high levels of particle matter were 15% more likely to die from coronavirus. Some of these fine particles that they're talking about are fuel combustion, which typically comes from automotives, refinery and power plants, and of course you also have tobacco smoke. Just so you know, the data complied was over 17 years and was from more than 3,000 countries. So smell and taste, that's really grown to be one of those extra symptomologies. So the loss in smell and taste has been associated with COVID-19. It should be included in the screening measure. If you have a loss of smell and taste, you're 10 times more likely to have COVID-19. Smell and taste, very simply, interesting, they are cranial nerves, and those cranial nerves are part of your central nervous system. So the chiropractors listening have to realize that there is a direct correlation between the nervous system and the immune system. Here's a picture just to go over the diagnosis of COVID. In your time, you can go through this, but you can see that it really shows the immune damage. It speaks to humoral immunity, which are your B and T cells. It speaks to your cellular immunity. It shows you what an antigen presentation is like. And it really shows you the SARS-CoV entry and replication and all the different options. If you were to just look at this, or if you wanted one picture to encapsulate to show a patient, this would be one. And if you described it, especially emphasizing that cytokine storm and all the things you want to do to enhance the cellular and humoral immunity, and decrease the cytokine storm, I think you would have interested patients. Obesity, not a surprise. is linked to severe coronavirus, especially in these younger patients under 65. It is an important predictor of severe coronavirus. In the US, one of the highest obesity rates in the world. And as we said earlier, adults are at a particular risk. When you're obese, you're inflamed. Fat cells are depositories for toxins. So now with everybody inside and having two essential things that can go outside for, number one, food, and number two, exercise, you have a chance, if you're communicating with your patient base, your families and your friends, to really emphasize now's the time to take care of yourself. In addition, the hypotheses of obesity may already have compromised respiratory functions prior to the infection. They may have been so heavy. Abdominal obesity, which seems to be more prominent in men, can cause compression of the diaphragm, lungs, and chest cavity. Chronic low-grade inflammation and increase in circulating pro-inflammatory cytokines are clearly going to play a role in some of the bad outcomes with COVID-19. Is this a preventable lifestyle disease? I don't think getting infected necessarily is a preventable lifestyle disease. However, your reaction once the pathogen comes in clearly may be preventable. It's a large segment of conversation now, really attributing to the idea of we need to take care of ourselves, and some of the countries that have been hit harder are those that are on healthier. So there's a lot of articles that just came out yesterday on the impact of nutrition on COVID-19 susceptibility and the long-term consequences. That actually would be a webinar in its own. Let's look at these underlying chronic illness. 42, again, I have American numbers. The UK numbers were not exposed to me. 42% obese in America, 75% are overweight. Again, the only thing I know is I think you're number 3 or 4, we're number 1. 6 out of 10 people have one chronic illness. 4 out of 10 have more than one chronic illness. Obesity increases the risk of death 3 times. Any of the aforementioned issues can lead to inflammation or elevating that cytokine level in the patient. Additionally, you really want to look at someone's belly fat. That's where you have the bulk of the issue. That's where that inflammation, that beer belly, for lack of a better term. Older, metabolically challenged, half over 65. So over 65, about half of the people are metabolically challenged. As you get older, we said before, you decrease immune function. 12% of the population is actually metabolically healthy. That's 1 in 7.5 people. So 1 in 7.5 are truly optimizing their metabolic health. This was fascinating for me in the implication of non-alcohol fatty liver disease patients with COVID-19. 202 patients were studied. 50% of them, when they were admitted to the hospital, had a liver injury, which would pertain to non-alcoholic fatty liver disease. But during their hospitalization, it went up to 75.2. Because of these ACE2 receptors, which are found in abundancy in the small intestine. Remember, the gut speaks to the liver, and on the liver. The liver also, as many people don't recall, has the largest amount of macrophages. There is a direct gut to liver, liver to gut axis, and without question, obesity is always implicated. Why are men having more hypertension than women? It was interesting in that, why do women respond better to viruses? And I always thought that the men had more hypertension because they were heavier than the women. Actually not. It's estrogenic compounds in women were found to reduce influenza. So they had a better response to the virus. And because of those estrogenic compounds, they also had a decrease in hypertension. So now we get to talk about the immune system. And the immune system is interesting in that it provides 3 levels of defense against disease-causing organisms. The first one is the barrier, or our prevention entry. That's our skin. People forget that our skin is a barrier to our immune system. Mucous membranes like the lung, gut, liver, etc. Some of the bigger things that we talk about through the digestive tract, and you'll see that I emphasize gut health a lot, you're also going to need a good amount, an appropriate amount of stomach acid and digestive enzymes. In addition, You should have that beneficial bacteria in the colon. So you have your strong gut microbiota. 80% of your immune cells are in your gut. It's where your macro and micronutrients are absorbed. Our immune system is interesting in that it is innate versus acquired immunity, or innate versus adaptive immunity. Innate is something that we had, since day one. It's a general defense. It's called neutrophils and macrophages, and they will attack a foreign invader or an antigen. We then switch over to acquired immunity, a specific defense, where we've got T and B cells coming from the bone. B cells are from the bone, T cells are for thymus. B cells produce immunoglobulins, and those immunoglobulins are now what we measure a lot. We have 2 slides at the end to really speak to the concept of antibodies. So let's talk a little bit about this. Let's talk about the theory. Let me give you the most leading edge thought. We now call it immune support. We don't want to call it immune boost, because if you're boosting your immune system, you may be turning your immune system on too much. Immune support means you're supporting your immune system to have a balance and an appropriate response to a foreign antigen. There's something called immune resilience, the idea that your immune system is resilient and, again, acts properly. What I like to refer to is, once we get immune support, we now get immune rejuvenation. Our cells rejuvenate every day. Through time-restrictive eating, intermittent fasting, we can get autophagy. So the idea of immune support to immune rejuvenation is the idea of the things within our lifestyle and the supplements to allow our body's immune system to be reinforced and reinvigorated. The key to this all is to enable our innate immune system and our adaptive immune system to function well. Foods like sugar overstimulate our innate immune system and decrease our adaptive immune system. So clearly, sugar and starch are very adverse to having a strongly, appropriately functioning immune system. So here's some foundation support. Lifestyle, very simply, diet, anti-inflammatory foods, fruits, vegetables, grass-fed beef, leafy greens, good quality sleep, 7 to 8 hours, where you can rejuvenate your immune system and detoxify your brain. Quality hydration, exercise. Obviously, everybody should exercise a certain amount, even if it's just for a walk outside, body weight inside. And then supplementation. We sometimes look past that. Why would you want supplementation? Because supplementation enables you, even if you eat organic food like myself, to raise the level of nutrients in a very fast manner. The first concept is you want to keep intestinal permeability and microbiota balance, which we'll go into more detail later. So the foundational immune support, notice I use the word support, vitamin C, vitamin A, vitamin D, NAC, NAC, glutathione, zinc, probiotics, and maybe one of the hidden minerals that makes so many enzymatic reactions go, selenium. So you guys can take a picture, or you'll get a copy. I'll send a copy of the slides as soon as I'm done. Here's your foundation immune support. Your vitamin C complex there's a vast body of research demonstrating the importance of vitamin C as a key antioxidant in humans and plays many roles in virtually every bodily system. This is 1,000 milligrams. It helps to support antioxidant, stress, and immune function. And in addition, it'll help support healthy cortisol balance. And cortisol is something that people have overlooked, but it's a stress hormone. Vitamin D3, 5,000 with K2. Should be called hormone D. Vitamin D is a critical vitamin that puts the brakes on aberrant immune system function. It's also been shown to be fabulous for upper respiratory issues. GI Restore. GI Restore is your proverbial formula in a powdered form that will enable you to keep your gut in a rejuvenated form. It's actually something I take every morning to help your gut respond to any kind of onslaught. Remember, 80% of immune cells are in the gut. I say that all the time. People have forgotten that through this COVID-19. NAC 600. So given the importance of sufficient glutathione levels in the body for supporting overall health and longevity, I like supplementing with NAC 600 because it can help patients in a variety of ways. Essentially, it acts as an antioxidant in the body to regulate oxidative stress, and it supports nitric oxide production and vascular function, which leads us to the master antioxidant, liposomal glutathione. Liposomal glutathione basically is a major antioxidant. It's the key antioxidant, and it's involved in metabolic reactions, and it has an immune system booster. So for me, I like the liposomal form. The liposomal form enables it to get into my stomach quicker. It enables it also to be protected from stomach acids. So liposomal is my choice for glutathione. And finally, and not really lastly, zinc. Zinc is designed to help you meet your daily zinc needs, Zinc Pro. Essentially, zinc helps promote healthy cellular metabolism, GI integrity and permeability, and of course, healthy immune function. So there's my foundation immune supporter. So someone called up and said, what do I do today, doc? What do I do? What do I need? Here is what you choose from. Pick from this cherry tree. Exercise may protect against deadly COVID-19. So a decrease in antioxidants is seen in several diseases like acute lung disease. Exercise has shown to actually help ameliorate it. So get everybody outside and moving like my little friend on his treadmill. Here's my antiviral support. Here we have quercetin. Quercetin and NutraCheix. Now, interesting, the reason I like quercetin is a great choice because it's an antihistamine, and quercetin has really come to the forefront in antiviral because it's shown to decrease viral replication, it's shown to boost the immune system, and it's also shown to decrease viral symptomology. And this is a beautiful formula that actually has NAC, quercetin, and alpha lipoic acid. EGCG, you'll see a slide on that. That EGCG is green tea. Brain support, which is a powder, and or we have it in capsule form. Brain support has turmeric, it also has rosemary, and it has the EGCG. And again, the EGCG has been studied, and you'll see the succeeding slide, to actually block docking ports. Vitamin D3 we've talked about. Interestingly enough, PEA and lipoic acid. PEA, that's nervies. So most people think that's just for nerves, and that was the original formulation. However, there's over 350 studies to speak to nervies as far as actually being an anti-inflammatory protocol. It's shown PEA to attenuate the potentially deadly cytokine storm. And lipoic acid also works with the watery and the fat part of the cell, has also shown to be anti-inflammatory. Turmeric decreases the NF-kappa B inflammasome, actually the NLRP3 inflammasome, and decreases the NF-kappa B pathway, so it's anti-inflammatory. And omega-3 fatty acids, we all know it's great for cell membrane health. So if you want an antiviral support protocol, here is your antiviral support protocol, supported by tons and tons of data and literature. So let's go through this idea and this virus and this cellular membrane. Any virus must enter a cell, replicate and damage the cell, and escape to infect adjacent cells. There is a specific sequence for viruses to follow. It has to go through the ACE2, it goes to furin, and then it goes to 3CL-Pro. So this gets a little sciencey. We've all talked about the ACE2 receptors. So the ACE2 receptors bring it in. You know, if the virus attaches to the cell and doesn't attach to the ACE2, it's not able to replicate. But by able to cleave to the ACE2, it gets in the cell and it actually cleaves and starts with an enzyme called furin. The presence of furin enzymes are on all cell surfaces and activates the SARS-CoV-2 into a wide range of tissues and organs. So it really shows why people get so sick with this particular virus is it can attack multiple sites at a time. Ultimately, through the furin, it activates and unleashes an NLRP3 inflammasome, initiating a flurry of immune reactions that can result in the infamous cytokine storm. The tropism of the coronavirus is due to the furin cleavage site in the spike protein, and this is not present in the previous viruses. Now, interesting, the 3C protease. So essentially, once the virus has entered the human cells, coronaviruses produce damage and spread to other cells by creating an enzyme called 3CL protease. Although several enzymes may be involved in the viral replication and spread, a 3CL protease is the most important for this particular individual coronavirus. All of these lead to the NLRP3 inflammasome, which elevates the ability, unfortunately, to have a cytokine storm. So again, the ACE2. The SARS-CoV-2 infects alveolar epithelial cells through the ACE2 receptor. The destruction of the epithelial cells and the increase of the cell permeability lead to the release of the virus. The SARS-CoV-2 activate the innate immune system. Macrophages and other innate immune cells not only capture the virus, but also release a large number of cytokines, chemokines, including interleukin-6. Your adaptive immunity is also activated by antigen-presenting cells, which are dendrite cells. Dendrite cells are in the gut. T and B cells not only play an antiviral role, but also directly or indirectly promote the secretion of inflammatory cytokines. Lastly, under the stimulation of inflammatory factors, a large number of inflammatory exudates enter the alveolar and can result in respiratory failure and dyspnea. So clearly the key is if we can block the docking of the S2. In addition to that, the key would also be if we can keep the cytokine response diminished. Here's a slide that really speaks to the idea of the ACE2, its gut and cardiometabolic health. So we know all these structures have a lot of ACE2. How is the ACE2 expression in the human heart? It's actually not in the muscle, it's in the periocytes. So those people that are having heart issues with COVID-19 are having these heart issues for two reasons. Difficulty in breathing puts a strain on the heart, and the virus can also attack the vessels inside the heart. Cytokine storm, or what I call this dangerous double-edged sword, which has truly been exploited in a very epigrammatic fashion. Let's go through the idea of cytokines. Cytokines are released. When they're released, they can be initially helpful, even though they're pro-inflammatory. When you have too much inflammation or too many cytokines being released, like having multiple strains of a virus. So let's take a second, and if I walk in, I go back to my office next week and a patient brushes against me, I may not get that sick. If I go to a restaurant, if they just opened it up and there were 6 people out of 100 that had it, and I sat in the restaurant for 2 hours and I got hit by multiple strains, I might need more cytokines, and that's a growing sentiment. In any case, most patients with severe COVID-19 exhibit substantially elevated serum levels of pro-inflammatory cytokines, including interleukin-6 and IL-1B, as well as IL-18. In addition, TNF is also released, all being characterized as a cytokine storm. C-reactive protein and D-dimer are found to be abnormally high. Ultimately, high levels of pro-inflammatory cytokines may lead to shock and tissue damage in the heart, liver, kidney, and the gut, ultimately leading to respiratory failure. These cytokines can mediate extensive pulmonary pathology, leading to a massive infiltration of neutrophils. Ultimately, we want to avoid and diminish the excessive release of the cytokine. Last webinar, we gave a cytokine storm protocol. And I put this in, I'm not going to go through this. You guys can look at it, guys and gals. You can look at the anatomy of a cytokine storm. It's very effective with the 5 parts. You'll see everything that you need to familiarize yourself with the mechanism. We also have the activation of the NLRP3 inflammasome. That activation is very simply at toll-like receptor 4. The ultimate is that toll-like receptor will stimulate NF-kappa B. NF-kappa B ultimately stimulates IL-1 beta and IL-18. In addition, it also makes the mitochondrial not function well, and people will have fatigue. The harder hit this particular pathway, the more fatigued and the more inflamed that you are. How would you block toll-like receptors? Well, number one, if you kept your gut in pristine condition, you wouldn't have the onslaught because something inside your gut called LPS stimulates the toll-like receptor. In addition, high levels of fish oils also sometimes can block that toll-like receptor site. So here we go here's your NLRP3 inflammasome protocol, sort of your cytokine updated storm protocol. EGCG green tea. If you're not going to take EGCG, 4 cups of green tea, quercetin, resveratrol, curcumin, ginger, boswellia, aloe vera, sulforaphane, omega-3 fatty acids, vitamin D, and a hidden gem, pro-resolving mediators. So now we can go over what carries those specific nutrients. Once again, brain support is going to have 2 or 3 different things. It's going to have your turmeric, it's going to have your quercetin, it's going to have your EGCG. Resveratrol, you're going to double down on resveratrol because resveratrol you want in a 2-to-1 ratio with quercetin, and it's in there, and you can actually get some more EGCG in resveratrol plus. Herb Ease. Herb Ease has your ginger, more turmeric, boswellia, and black pepper. 3 caps daily, a fabulous choice. Sulforaphane complex. Sulforaphane is a nutrient that cruciferous vegetables produce. Those cruciferous vegetables that produce sulforaphane enable NRF2 pathway, which is an antioxidant pathway, to increase, and your NRF2 pathway also decreases inflammation. I upped the dosage on your omegas, so I went with a liquid Omega Pure EPA DHA 2400, 1 teaspoon to tablespoon daily. You need more omega-3s if you're in an inflammatory state. You have, of course, your D3 5000. Take 1 to 2 soft gels daily. Your pro-resolving mediator Resolve. Everybody, I take this every day. It allows for the resolution of inflammation and the homeostasis of the initiation and the resolution of inflammation. So this PRM is a great choice for overall inflammation when you're in a healthy environment, and when you're in an unhealthy environment like we are now, it really manages and modulates inflammation. Again, this has been studied at Harvard University and is one of my strong go-to products. So we talked about ECGC before. Essentially, ECGC blocks 7 proteins of the SARS-CoV that were tested. 18 compounds were compared with 2 FDA drugs that they're looking at in COVID-19. The conclusion was EGCG was better than any other supplement and any drug at blocking these docking sites, and therefore it should be explored as a drug candidate for the treatment of COVID-19. Vitamin D3 is a receptor site, and it can inhibit NLRP3 inflammasome. So obviously by blocking NLRP3 with vitamin D3, I always like my vitamin D3 with K2, great choice. Vitamin D3 and K2 is a great choice for multiple reasons, but it also helps with the efficiency and the ability to transfer from the innate to the adaptive immune system. This slide really depicts that. Evidence that vitamin D supplementation could reduce the risk of influenza and COVID-19 infections and deaths. Reducing the risk of infections because it can reduce the concentration of cytokines and the ability for the virus to replicate. The study showed you had to take 10,000 IUs per day of vitamin D for a few weeks. Now you can just take the D3 5000 with K2 and take 2. When you take D3, you always want to take it because it's a fat soluble vitamin with food, or Nutridyne has a 10,000 D3 10,000 with K2, and you can do that for the first month and then switch to the 5,000 that are recommended. You want to raise the concentration of vitamin D. So the conclusion was for the treatment of COVID-19, higher D3 will be useful. Little heady, this is where at some point we can go in functional medicine. The bottom line is that methylation, if you methylate, you have a better chance of fighting a cytokine storm. If you hypomethylate, you won't be able to. So methylation is a copy of your DNA. It's a methyl group in a very simplistic manner. So it's your two footprints. When you hypomethylate, you're missing one footprint. And when you miss that footprint in hypomethylation, which you typically can get if you have a SNP or a histamine reaction, you put yourself in a position to increase the cytokine storm. So for now, I just want to, this is a seed that in 6 months or a year, because we intend to do more continuing ed, you can really see how you can get to the gene expression and the gene expression to see who's more susceptible to certain conditions. Here we're really showing all that you need in the overexpression of interleukin-6. Interleukin-6 is the true culprit. Originally, it was just the NLRP3 inflammasome, which was interleukin-1 beta and interleukin-18. Interleukin-6 is also released, and it throws off the balance within your adaptive immune system. In addition, here's a great brief introduction to interleukin-6. Everybody can look at the picture. Interleukin-6 is an important member of the cytokine network. It plays a central role in acute inflammation. It's a multifunctional cytokine, which plays an important role in human metabolism, autoimmune cell differentiation, and disease treatment, etc. We always want to decrease our interleukin-6. Having said that, interleukin-6 is also implicated in damage in people's lower back. So if you have a lower back problem and you're always bending at your lumbar spine and you're damaging the collagen, you'll raise your level of interleukin-6. Again, lifestyle, chiropractic, alternative lifestyle will play a key role in people's outcomes in this health pandemic. Interleukin-6, this was a study with 9 severe COVID patients. The symptoms were seen in the order of fever, cough, dyspnea, fatigue. Common comorbidity is hypertension. Interleukin-6 was seen or increased with body temperature, and it was also increased with cholesterol, C-reactive protein, and D-dimer. The conclusion very simply was that dynamic change of interleukin-6 can be used as a marker for severe COVID-19. NRF2 pathway inhibits interleukin-6. So whereas you want to stop the NF-kappa B pathway with the NLRP3 inflammasome, you can inhibit this particular interleukin by stimulating NRF2. And here we have, and we can get you the products that correlate with this, but let's just throw them out right now, and I think you probably can fill them in. Number 1, DHA. Number 2, time restrictive eating, caloric restriction. Curcumin, green tea extract. So you already have your omega. You already are looking at your brain support, milk thistle, alpha lipoic acid, sulforaphane, ashwagandha, and coffee. So you have your choice of beverage or hot beverage. Coffee is great for stimulating the NRF2, and your green tea is also great. So you have all your beverages that you may want to consider. Alpha lipoic acid. We could spend all day on this. I'm a huge alpha lipoic acid antioxidant, and it truly stimulates the release of glutathione, and you could put this in the NRF2 stimulating pathway. So what's the next big thing ahead? Well, I'm a big proponent in the vagus nerve. The vagus nerve runs from the bottom of the brainstem, the medulla oblongata, down through the transverse colon. It inserts on the outside of the transverse colon. It senses what's going on inside your gut. So your vagus nerve, which is your parasympathetic nervous system, is actually sensing what kind of bacteria and what the status of your gut environment is. You're now seeing a direct correlation between your nervous system via your vagus nerve and your immune system and your gut health in your immune system. The body is all interconnected. The reason that the vagus nerve is afferent, going back to the brain, is very simply because of its anatomical position on the outside of the transverse colon, and it's sensing what's going on the inside. That's why it's only 10% efferent coming from the brain. So let's go through this again. Medulla oblongata, vagus nerve runs from to the transverse colon. It innervates everything in between the neck, the thorax, the liver, the pancreas, the intestines, and the lungs. Vagus nerve communicates with our central nervous system. The vagus nerve also communicates with our parasympathetic nervous system. It's the captain of the ship, and our enteric nervous system. Our enteric nervous system is the largest accumulation of nerve cells in the body. It regulates the immune response and detects nutrients and motility. The enteric nervous system is the reason that they call the gut the second brain. So the interaction of the enteric nervous system, vagus nerve, leads to the bidirectional communication between the gut and the brain and the gut. And here's a picture that will depict all the branches affecting the different organs. One branch in particular, please make note, is that the vagus nerve communicates with the lung. So as we'll discuss in a few minutes, there's a gut to lung axis that we need to consider. Low vagal tone. So remember, the sympathetic and the parasympathetic are not volume. They're like a seesaw. So when vagus nerve tone goes down, sympathetic tone goes up. Low vagal tone is seen in the IBS and IBD, irritable bowel syndrome and irritable bowel disease, favoring peripheral inflammation when you have that. Also, when you have low vagal tone, you have a decreased secretion of hydrochloric acid, pancreatic enzymes, and reduced bile. The reduction of bile can lead you down a path of increasing your incidence of SIBO, which we can do a webinar on, SIBO, small intestinal bacteria overgrowth. The takeaway here is targeting the vagus nerve through stimulation would be of interest to restore homeostasis in the microbiotic gut to brain axis. By stimulating the vagus nerve, you will dramatically reduce inflammation, improve outcomes in rheumatoid arthritis, and inhibit cytokine production to the amount of 30%. Stimulating the vagus nerve enhances motor and cognitive recovery, decreases cerebral edema, also reduces the damage to the blood-brain barrier damage, and always will lead you down a path of neuroprotective effects. Huge takeaway here in that the vagus nerve stimulation actually has a positive effect on the gut. The study here in 2013 showed by stimulating the vagus nerve, you were able to decrease damage that came from tight junctions and the release of LPS. So they actually stimulated the right vagus nerve to ameliorate the damage of tight junctions and inhibit the activity of the release of myosin, which is one of the proteins in the tight junctions, and the increase, as we know, NF-kappa B, which is the signal transducer of inflammation pathway. Vagus nerve stimulation, bottom line, attenuated disruption of intestinal tight junctions. So if you have a gut problem, you want to be able to stimulate the vagus nerve. Now, everybody's probably saying, do I have to gargle? Do I have to cough? No. Here is a vagus nerve nutritional support, soon to be seen in my upcoming book. Let's take a look at the products now that I recommend. Vagally mediated probiotics. As you know, the environment is a critical element for vagus nerve communication. Ultrabiotic Daily Multi-Strain has 7 different strains. Many of them are vagally stimulatory. So that's a great choice for overall health, but vagus nerve health. Here we have butyric acid and fiber. You can get this in Dynamic GI Integrity. Dynamic GI Integrity has products like glucosamine HCl, L-glutamine, which is really a truly great product that helps heal mucosal lining, zinc carnosine, which is shown to help heal tight junctions, DGL licorice, apopectin, aloe vera, slippery elm, and mucin, which are all pointed at regenerating the gut lining. In addition, it's got herbal extracts, MSM, and quercetin, which is known to decrease the inflammation in the environment of the gut. You can increase bile acid flow. My favorite product is, without question, for that, Digestive Complete. Digestive Complete incorporates stomach acid or digestive enzymes for stomach, pancreatic enzymes, and it also incorporates specific taurine, which helps with bile acid flow. Omega-3 fatty acids, you've seen this product before. Omega Pure EPA DHA 1000, and citrulline is a great choice. Citrulline increases heart rate variability, and the product is called Pure Citrulline. Always recommending time-restrictive eating. Time-restrictive eating or intermittent fasting stimulates the vagus nerve, because when you fast, you stimulate something called your migrating motor complex. And of course, sleep, everything resets while you sleep. The other option, and if anybody has any interest, you can reach out to me. I stimulate the vagus nerve via using a specific laser. It's 30 seconds on each side. I'll give you the ability to contact me if you have any questions on that. Here's my Dr. Rob's Gut Matrix. As we get towards the finish line, we probably have another 10 minutes of lecture, and then we'll open it up right at 5 to 10 o'clock, my time. So that's 5 hours later, 3 o'clock, your time for questions. So here's my Dr. Rob's Gut Matrix. I probably use this in every one of my talks, and this could be a whole talk all to its own. 80% of immune cells are in your gut. It's where your macro and micronutrients are absorbed. Your small intestine is the bulk of your intestines. It's 90 to 95% of the length. The reason that they call it small is very simply because the diameter is 1 inch, whereas the large intestine is 2.5 inches in diameter and there's 3 layers. Conversely, the small intestine is a single layer epithelial cell, which has the thickness of a wet paper towel. When unraveled, has the surface area of a tennis to a basketball court. Its sole purpose, your small intestine, is to absorb into the bloodstream digested food particles, nutrients, and water. When your gut becomes leaky or too permeable, now undigested food particles are able to pass. Bacteria, yeast, and viruses now go into your bloodstream. When these foreign particles or foreign bodies pass your gut that aren't supposed to, your immune system recognizes them as foreign or antigen, and if you will, the game is afoot. Your immune system activates, attacks them, and you can have localized inflammation, systemic inflammation through the bloodstream, or even autoimmunity, because if it continues and it's a high onslaught, your immune system gets confused. If your lifestyle is bad, it overregulates the innate and decreases the adaptive. And if you will, for lack of a better term, all hell breaks loose. So in your GI tract, you wonder, why do I have leaky gut? Well, one of the biggest reasons is dysbiosis, an unleaveling of good and bad bacteria. You need about 85% good bacteria. You also can cause yourself to have food sensitivities, or food sensitivities can cause leaky gut. So you have a lot going on in your gut. Now, when your gut is too permeable, many toxins pass your gut, and about 75% of those toxins get to your liver via the bloodstream. 25% of the toxins get from your gut to the liver via the portal vein. So if you have a gut problem, you have a liver problem. We indicated that in like slide 23. That liver dysfunction is due to toxins and chemical overload. When you have a gut issue, you have a higher incidence of blood sugar problems, insulin resistance, prediabetes, and diabetes. In addition to that, you also can have a body composition problem. You have an increase in obesity. So remember, we said leaky gut, increase in autoimmunity. We just talked about the 5 leading comorbidities: obesity, diabetes, issues with liver, leaky gut, leaky heart, CVD problems. So as you can see, if you really want to centerpiece it all, you may want to look at gut health as a great starting point as you come back to the office or to talk to patients in your telehealth, telemedicine setting. In addition, a leaky gut leads to an excessive release of cytokines. Cytokine storm. Cytokines are inflammatory. They'll cause arthritis and joint pain and joint injuries. And also you get the release of MMPs, matrix metalloproteinase, your body's own proteolytic enzymes, which eat fibrocartilage, which leads you down a path of soft tissue injury like disc injury. Or increase in autoimmunity, increase in thyroid issues. Gut on fire, brain on fire. Whatever you do to your gut, you do to your brain. Whatever you do to your brain, you do to your gut. Influencing your microbiota Your microbiota is influenced by your bacteria. Your bacteria can have a protective effect. It can have an indirect promotion of health, and it can have a direct promotion of an antiviral immune response. Your probiotics, the plethora of probiotics that Nutridyne offer, are a go-to for you to enable good gut health and really lead patients, yourself, your family members on a path to good health. Interesting with the GI tract, 53.4% of patients had COVID-19, also had the RNA virus in the stool. 23% of the patients tested positive in the stool while they were testing negative in the PCR test. So the bottom line here is that the virus sheds 2 weeks after the abatement of respiratory in the stool, and it sheds 4 weeks after the abatement of fever. So this study really spoke to the end of February, spoke about the idea that digestive system may serve as an alternative route for SARS-CoV-2, so it can also be transmitted in fecal to oral fashion. Here's a study that I just was talking about, that the SARS exits in children's GI tract for a longer period of time. It was remained detectable in stools longer than 4 weeks after the abatement of fever. So here was a study fascinating in that 24 COVID-19 patients were discharged. Each patient received 2 consecutive negative throat swabs, 1 negative rectal swab. The median viral shedding was 12 days, the shortest was 4, and the longest was 34 days. And now that we get to one of the new exciting axes that I've seen, the gut to lung connection. So the gut to lung connection or gut to lung axis is a bidirectional crosstalk that occurs between the gut and the lung and has been termed the gut lung axis. Intestinal disturbances have been observed in certain lung diseases, which have been shown to be mediated by the gut microbiota and some probiotics, which have beneficial effects on lung health and the treatment of respiratory disease. It stands to reason that a deeper understanding of the gut microbiome and its role in respiratory disorders will aid in the design and development of improved treatment for lung disorders. The gut and lung microflora are clearly linked by nutrition, immune system, and digestion and respiratory health through mutual communication, linking this intricate axis. Bottom line, the lung microbiota or microbiome is found in the lower respiratory tract, is a collection of microorganisms, particularly found on the mucus layer of and the epithelial surfaces. So this emerging and exciting field of investigation will be leading us to new ways of thinking about this axis and conditions in general. So how does the gut and the lung communicate? Well, they communicate through the oral pharynx, through environmental products and bacteria. They communicate through the blood via bacterial fragments, short-chain fatty acids, and immune cells, and also through nerve impulses, which are signals via the vagus nerve or vagal afferent innervation. So here we've got, interesting, this pulmonary microbiome, in that in healthy individuals on the left, lungs and gut harbor marked different microbiomes. The composition of the lung microbiome really closely resembles one of the oral pharynx. However, in critically ill patients with ARD, acute respiratory disease syndrome, lung microbiota may be enriched with gut-associated microbes. So potential pathogens can enter the lung via breathing and possible translocation of the gut. So the resulting state of dysbiosis promotes inflammation and acute lung injury. Bottom line, there you have it. There's a translocation of bad bacteria going to the lungs, increasing your incidence of critical lung illness. Population-based gut microbiome associations with hypertension. So here you're seeing things that can damage the gut, drugs, food, and lifestyle, all lead you down a path of hypertension. So I'm drawing a link from the gut to the lung and now gut to hypertension. Here was a study of 41 patients that had an ideal blood pressure. In the study, there were 99 patients that had hypertension. In addition, there were 56 patients that had pre-hypertension. The patients with pre or hypertension had a reduction in bacterial diversity in the gut, a critical element. Good bacteria, bacterial diversity. Let's go on. Phase 2, the scientists transplanted fecal matter from real human patients into germ-free mice. The mice that received the fecal matter from hypertensive patients then also developed hypertension. So it was the gut microbiota that increased their incidence of hypertension. Conversely, in another article, researchers transplanted feces from mice without hypertension into mice with hypertension. The result obviously was, believe it or not, reduction in blood pressure in mice with hypertension. Once again, the correlation between the gut bacteria and hypertension is directly linked. Short chain fatty acids, which you can get from good probiotics and prebiotics, which you can see on the Nutridyne line, and I can answer any questions that you like about that, show a direct link from gut to hypertension, i.e. through dietary fiber, gut bacteria, which produces short chain fatty acids. So bacterial populations, patients with higher blood pressure had lower levels of species that produce short chain fatty acids. So you can see how the microbiota can be controlled by many factors, including diet, physical activity, genetics, and epigenetics. Your microbiota can be controlled by all these factors. The influence of the gut microbiota on the host may be partially explained by the generation of short-chain fatty acids, including the beneficial acetate, butyrate, and propionate, and a non-beneficial lactate. And this is a great picture. We can go through all this, ultimately how the gut is tied to blood pressure increasing or decreasing. So here's my Super 7 action plan. Number 1, let's talk about reset. 1, you want to reset their diet, lifestyle, and mindset. You want to give them an anti-inflammatory diet. You want to give them a lifestyle that enables them to sleep. You want to give them a lifestyle that incorporates exercise. Or number 2, you want to remove. And again, this is a whole webinar right here that we can go through. Remove unwanted pathogens. How do you do that? Oregano oil, thyme oil, they're great to remove upper respiratory bacteria. They're great for immune system. Remove from your lower bacteria or your lower bowel, berberine. It's for your dysbiosis patients. It's for your train wreck patient. Then you want to replace. How do you replace? Well, you replace digestive enzymes and stomach acids. You're going to replace pancreatic enzymes, digestive enzymes, and bile flow. Regenerate. You want to regenerate and heal and seal the damage intestinal mucosa. You want to reinoculate. You will reinoculate with good quality pre and probiotics. After that is really retest and reintroduce. You want to make sure that you've got an perfect elite outcome in your patients, and then you can reintroduce certain foods that you may have removed in step 2. And last, you want to retain your health and your GI integrity. And here is, as opposed to the whole protocol, let me give you, because I know that many have gone down the path of using gut protocols. Let me give you my 1 month, and you can repeat it and repeat it and repeat it. Here we go. I like, it says 2 scoops, a scoop of dynamic GI integrity and GI restore. So you get the mix of the inflammation and the restoration and healing and sealing. You could take 2 scoops 2 to 3 times a day. Pro-resolving mediators, which again will decrease the inflammation. Where is there a better choice or obvious choice than to decrease the inflammation in the gut? And my suggestion is 2 soft gels 3 times a day. Digestive Complete, once again, good for stomach acid digestion, pancreatic enzymes, and increasing bile flow, 2 caps per meal. Spectrum AR, so you're getting your oregano oil, 2 soft gels 3 times a day. And Espellardi, it's a yeast that functions as a probiotic, a great starting point, and you can take 2 caps of that daily. That's my 1 month, you're gonna get them moving gut protocol. And let's go through the differences real quick of antibodies. So antibodies are made in response to a virus. However, they persist in the blood, acting like sentinels and rallying an immediate response should the virus try to invade again. The antibodies are unique signatures, different protectors modeled after encountering different viruses. So finding them is a signal of past contact with a particular virus. The bottom line, the takeaway, it's the difference between catching an invader red-handed versus going back to the crime scene and dusting for prints. So the true difference between IgG and IgM, we could spend 20 minutes on this. The bottom line is IgM comes out at the beginning. It's a much larger antibody, but IgG is smaller and extremely abundant. 75% of immunoglobulins are IgG, and it's the only immunoglobulin that can pass the placenta. So with the conversation switching to antibody tests, and we have them in the States, and I'm actually administering them to my patients or scripting them for my patients, let's take a quick look at what's going on. Here's your SARS-CoV RNA and antigen. It starts at day 0, and in theory, it should end on day 28. However, the onset of symptoms typically comes via median symptomology, 5.1 days. You'll see at about day 7, IgM, which is earlier, will become detectable. So IgM comes up and pretty much decreases on day 21, whereas IgG remains in the blood and provides long-term immunity. You'll see IgG increase at about day 14. So essentially, somebody who's had COVID-19 and is proverbially finished with it, we would have to also check the viral shedding through the stool, would be a negative for IgM, positive for IgG. If you're negative like I am, I've been exposed, but I wasn't infected. If you have IgM positive and IgG negative, you're at the beginning of the onslaught. And if you're IgM and IgG, you're in the middle, and you're looking at that middle between day 14 and day 21, theoretically. So as we get towards the questions, please keep an eye out. Rob at Nutridyne Europe is going to be promoting my book, Superhighway to Health, 7 Steps to Optimizing the Gut-Brain Connection. So Oliver Wendell Holmes once said, the mind once stretched by a new idea never returns to its original dimensions. If anybody has any questions, give me some feedback. Facebook's a great way, Dr. Robert Silverman. Every day now, we've been doing a 1 o'clock Eastern time to 1:30. It's all health updates, really oriented towards COVID-19. Instagram is the same, Dr. Robert Silverman. There's my website, and if you're interested in the laser, you can contact me, and I have a laser mastermind group that I can help you greatly with, and it's right there on Facebook. And I'm now going to turn it over to Rob and answer any questions that you have.
Thanks so much, Rob, for that great speech. Just a few questions. If anyone's got any more questions, feel free to just stick them in the questions box. In your opinion, are blood type A more affected than others simply because they're a larger number of people?
No, it was actually the percentage. And actually, I think O is a larger amount of people also in the world. However, I think O is the largest percentage in the world. No, I'm sorry.
Yeah, I think you're right there.
Yeah. So it's universal. So in any case, the reason that they did that was it was a percentage of people who were infected with O and A, and that was almost 2,200 people, and that study came from China. So I just think it was the percentage. Nobody knows why. It's just a proverbial data point that nobody can really get their head around.
Cool. Does exercise have a positive or negative effect on vagus nerve?
Exercise should have a positive effect. Exercise has an overall positive effect on everything. However, vagus nerve, really what I've seen for speed, it's the laser, and then use that nutritional protocol to maintain the tone.
Okay. What time frame is suggested for time restricted eating?
I like 14 and 10, meaning 14 hours of fast, 10 hours of eating. And if you could push it to 16 and 8, that would be even better. 16 hours of fast, 8 hours of eating. And the reason is, after 13, in your 13th hour, you start with autophagy, which is the body's own self-devouring of cells, enabling you to break cells down, grow cells back to get that immunorejuvenation type of effect, building your immune system, and it picks up again at the 15th hour.
Excellent. And finally, it's just a question on your opinion, really. Do you think there will be mandatory vaccines in the future for COVID-19?
Wow. There you go. There's a tough one. You know, chiropractors are hot on that. I am a chiropractor. So what I'll say is, I think that where we are here in the States, I can't speak for you guys. I know that they would love to have a vaccine. I don't know if they're going to make it mandatory or not. It's too political for me.
Yeah. Well, that's it in terms of questions. So I just want to thank you, Rob, for the past hour of learning. For everyone else, we will be speaking, Dr. Rob and I, tomorrow about a course which covers detoxification, brain health, gut health, a whole host of things. So look out for that one. So thank you again, Dr. Rob. Thank you everyone for listening in, and have a great the rest of the day. Thank you.
Thanks for having me. See you soon.
See you soon.